So one other reason to see an epileptologist is there's actually a very high rate of being diagnosed with epilepsy and not actually having it. So in general, when we have a patient that is not well controlled with epilepsy, we bring the patient into the hospital, into the epilepsy monitoring unit, and we do video EEG. And we find that about 10 to 40% of patients that come into the hospital for video EEG actually don't have epilepsy. And some of these are patients that have problems with their heart or other explanations for why they have shaking and loss of consciousness. And some of these are actually conversion disorders. It's a psychological problem. And one of the problems is that you may have someone who has been treated with these medications that do have side effects for 5 to 7 years on average for something that is misdiagnosed. And if the problem is a psychological problem, the likelihood of making progress with that and getting over that there's some evidence that patients do better when they're diagnosed earlier.